So you're thinking about getting vertical or off-angle nipple piercings, but you don't know what you should know before you get it done. Well, you're in luck because you're about to find out. Coming up next on Consultations by a Piercer, episode number 42. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful and everything else, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. What we're going to talk about today is piercings that are done through the nipples, either male or female. We'll just kind of combine it, though they both have a little slight difference here and there. These are piercings that are done either straight up and down or at a slight angle, unlike the more traditional, like straight through horizontal. If you want something a little bit different, they can be kind of fun. Now, average healing time on these is anywhere from 6 months to a year, just like any other nipple piercing. During which time, I'm going to suggest that you do kind of two primary things. The first one being is clean the piercing twice daily using a sterile saline solution. There's kind of two delivery methods with the saline. Either if it's a fine mist, just mist the area, leave it be for about 5 minutes, and then dab dry. Or if it comes out like a squirt gun, then I would suggest using a sterile gauze sponge, soak it up, lay it against it, and do a cold compress for roughly about 5 minutes, and then pat dry. Now, personally, my favorite, and what I generally suggest is a Neomed's Piercing Aftercare. It comes out in a fine mist, really easy to use. But if you can't find that, don't worry. There's various different other brands on the market in styles. The main things you want to look for is it is a pressurized can. It says sterile on that can, and when you turn it over and look at the ingredients, it says sodium chloride in purified water. Nothing else, as in no preservatives or anything else. The other thing I suggest doing is at the end of your shower, stick your chest out like you're proud and let the water flow over the area for about 30 seconds. What we're doing when we do that is, both of these things, is we're removing that discharge that hardens collects on the jewelry. It can be uncomfortable when it moves or shifts, and it can also agitate the piercing, which can lead to issues. If you get a situation where it doesn't seem like it wants to come off there, don't start pulling everything you think of that has a cotton tip on it or a sharp point and dig around in there. See your piercer. Have them clean it for you. Also, they may need to take a look at it because there might be something else going on. Now let's get into the things you don't want to do. Cross-contamination prevention. Wash your hands before you handle it. Try to handle it by the ends whenever possible. The only time you really need to have any contact with those piercings is when you're checking the tightness of the balls, which I generally suggest doing once a week. No oral contact or exchange of bodily fluids on, near, around the piercing. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing, it needs to be cleaned on a regular basis. Do not swim. I know you're going to see conflicting things and hear conflicting things about the swimming. The reality is that any body of water that's large enough for you to submerge your whole body in and swim around and move around is filled with microorganisms. Now, microorganisms, when they enter into an open wound, as a foreign pathogen, can cause infections. So it's always best not to swim during the healing process. The other problem is the harsh chemicals that are used in most pools is not going to feel terrifically great and can cause problems. Keep pets away from it. Don't let them sleep in the bed with you, especially under the covers. Everybody always gives me an odd look when I say this. I'm not really concerned about like actual contact. What I'm concerned about is the amount of bacteria and other things that they carry on their fur and everything else that they can get smeared all over the piercing area and cause an infection. Now let's talk about trauma, clothing, and abuse. Abuse. Do not sleep on the piercing. Sleep on your back or your side. I don't care if it feels good to sleep on them. Chances are is that pressure will cause issues, regardless. Do not spin, rotate, or move the jewelry during the healing process. There is no purpose to this, and it's probably going to cause problems. Also, don't constantly touch them to see if they still hurt. Also, of course, don't play with the piercing. It's a good idea, especially if you're female or have a female body, that you do wear some type of clothing that's going to reduce the movement of the area for the first 2 weeks. Experiment, see what's going to work best for you. Most women say a sports bra, men's A shirt, tank top, something that has kind of even support works best for them. Experiment and see what works best for you. And also, you do want to probably wear something while you're sleeping. That constant, what we're trying to do is eliminate the movement. Usually, when you move around and there's any movement for those first couple of weeks, it's just uncomfortable. So it's more of a comfort thing than anything else. Completely avoid contact with the piercing. Think about that one. They tend to be, you don't realize how much you touch your nipples against things until you have your nipples pierced. Just to let you know, it will train you, and it doesn't feel good. So kind of take into account that, especially when you're lifting things or moving things or what have you. It doesn't feel good, and it's not good for the piercing if it doesn't feel good. Risk involved, of course, the biggest risk that can be involved with any piercing is rejection, though it's pretty low if they are done properly. And it isn't more so for this type of piercing angle than it would be for a normal nipple piercing. The other thing is losing the jewelry or the ends. You do need to check them on a regular basis. As I mentioned earlier, I suggest checking them once a week. The other thing would be the piercing closing. Nipple piercings are notorious for closing very rapidly, even after you've had the piercing for a number of years. It is always best to leave something in them. Now let's talk about placement and angle. Basically, it really depends on your anatomy. And if you have what is would be referred to as a female anatomy, then the piercing is done through the base of the nipple because they're developed and not into the areola at all. With those that have male bodies, or what's traditionally called male bodies, then it is usually done, if the nipple's developed enough, it'll be done exactly the same way. If it isn't developed, they can do them behind the nipple into the areola. The idea is to try to do this in a way where it doesn't create the hammerhead effect, where you have kind of two tunnels on both sides and this little nipple in the middle. But sometimes that's unavoidable, and it's something that you need to discuss with your piercer. As far as the angle, it can be done straight up and down, at a slight angle, what have you, what makes you happy. One of my favorites is to kind of do them like this or like this to give it kind of that chevron look. When the nipple is marked, usually the nipple needs to be erect, so they have a clear understanding of where that nipple tissue ends and where it begins. It's especially important, like I said, because on those with female anatomy, we want to avoid the possibility of causing problems in the milk ducts in the areola. Now let's talk about jewelry. Standard straight barbells are the best option, hands down, and pretty much what you're going to wear during the whole healing process and probably afterwards. These angled piercings do not do well with circular jewelry, so I would not even consider putting a ring or a circular barbell in these after they healed. You do not want a curved barbell, you want a straight one. As far as the type of barbell, it can be either threaded or threadless. Internally threaded barbells are the standard and what you should expect and get when you go to a professional. Now, we're going to pierce long to allow for inflammation, swelling, and you do probably want to downsize a shorter one in anywhere from about 2 to 3 months. If it's constantly getting caught on things or you're noticing that it's adding pressure, which can sometimes happen with these, especially the vertical ones, because it'll work almost like a lever and push outward, changing them sooner may be a better option. If you notice any problems with them, that might be one of the things you need to discuss with your piercer, possibly downsizing them sooner than later. Now let's talk about pain in the piercing experience. Usually when it comes to pain, most of these are about a 3 to a 6. There's always somebody out there that says it's an 8, but for most people it's not nearly as bad as they think it's going to be. It's not the most pleasant sensation. And to be honest with you, especially with those with male nipples, the clamps, the forceps can be a bit uncomfortable. So that's kind of the main part of the discomfort, in my opinion. A breathing exercise is always helpful. I'll usually tell you to take a deep breath through your nose and hold it, and then exhale through your mouth. Basically, smell the candle or smell the birthday cake and then blow out the candles. This piercing can be done freehand. However, I prefer to do them with forceps. What we will do is after it's marked, disinfected and marked, we'll put you in a reclined position, clamp the area with the forceps so that they're in alignment, inject the needle in and through, remove the forceps, and then use a guide pin attached to the barbell to push the needle out and the jewelry in. Take the guide pin off, put the new ball on or in, and then apply a little bit of saline spray because it feels good, and you're done. Now, as far as the aftermath, you're going to notice a little bit of throbbing and aching. That usually lasts a few minutes. They are going to be tender to the touch for some time, sometimes up to a month with certain people. You might see a little bit of slight bleeding off and on for a few minutes, not anything really to be worried about. But that's it. You're pretty much done. Now let's talk a little bit about anatomy again. The nipple should be pronounced with females. Males, maybe not as pronounced, but it's best if it is. Should be done through the base and not into the areola on those with female anatomy. Male anatomy can be done, but like I mentioned earlier, you need to discuss whether or not it's going to create the hammerhead effect if you are going to have to go in, if you have underdeveloped nipples and it needs to go into the areola. And lastly, what to consider. Usually these are done in sets. You can do them in stages. You can do one and then heal it out and then do the other one. But most people do them at once. And the advantage of doing them both at once is you're getting through that healing process all at once. You're not going to have to repeat it. You're not going to have to prolong this healing any longer than needed. However, disadvantage is you have two that are completely off limits to your partner and everybody else, and you have two areas on your body that you need to avoid contact. Like I mentioned earlier, avoid contact with the piercing. They tend to be like curb feelers. They get in contact with everything, and they do not feel good. Your body's training you to avoid contact. Listen to it and do as it is advising you, which is don't touch it. Downsizing. A lot of people think, oh, I don't need to. It makes a huge difference. Not only do they look better, but you're removing that sliding back and forth or removing pressure when there's pressure applied to it outward. It's always a good idea to downsize on a timely basis, sooner if needed. Always advise, ask your piercer for advice when it comes to that. Lastly, are you going on vacation? If you're going on vacation, I would suggest waiting until afterwards to get the piercings. Nobody wants to have a healing piercing while they're on vacation. Not only can you not control the environment that you're in, you may be exposed to pathogens your body has no immune system for or immunity for. Also, you're probably going to want to swim, and you can't swim with a healing piercing. So best to do them either before or after, or way in advance of a vacation or after you get home. So what's your experience with vertical nipples? Did you have a good one? An okay one? Well, leave a comment. Till next time, your soap and gilly piercing seal with ease without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.